Chapter 3 addresses cultural and pharmacogenetic considerations. Ethnopharmacology is the study of drug responses that may be unique to an individual owing to social, cultural, and biological phenomena. The emergence of the ethnopharmacology highlights the need for nurses to use knowledge and research from the social sciences as well as the biological and physical sciences to provide holistic nursing care. If we're to think of pharmacogenetics, it integrates the study of pharmacokinetics, pharmacodynamics, and variations of the predicted response to a drug due to genetic factors. The nurse must integrate knowledge of pharmacogenetics within patients' cultural context. Culture is defined as the set of learned behavior and ideas that human beings acquire as members of a community. A community is a cluster of individuals whose function as a group to attain cultural universals. Cultural universals are designed to meet the community's survival needs and common goals, such as the obtainment of food and other practices that maintain the group. The concept of transcultural nursing was formalized by a nurse anthropologist. She founded the Transcultural Nursing Society in 1974. A challenge for nurses worldwide is the degree of cultural diversity owing the migration and global movements. The thing that nurses have to remember is numerous cultures engage in the use of traditional health practices. And those traditions can include teas, herbs, spices, special foods, as well as homeopathic remedies and ointments. What we are to do is to assist with complementing the health practices of what is in the culture and what the prescribed or mainstream health practices are provided for the patients. In 1998, Giger and David Heiser developed what is known as the Transcultural Assessment Model. The model suggests that all cultures have 6 cultural phenomena: communication, space, social organization, time, environmental control, and biological variations. The model has been frequently viewed for relevancy and has been clinically useful for nurses and other members of the healthcare team. This illustration comes from your text, figure 3-1, and shows the culturally unique individuals and how important it is for nurses to include all these different phenomena in their daily assessments. Communication is the first concept that we'll discuss in this assessment model. It occurs verbally and non-verbally. Nurses must be alert to different types of communication styles among patients to provide culturally competent care. It is important for us to make sure that when language is not understood, that we use translators whenever possible. Nonverbal cues can be used with our patients. However, we can never assume that our patient properly understands what is being taught just because they're nodding or they're being polite. All cultures have a prescribed norm for greeting and addressing others. Americans of European descent may be more informal when greeting and addressing others than descendants of non-European cultures. Nurses must keep in mind that patient-nurse interaction in healthcare settings are considered formal, and that informal styles of communication should be used only after careful consideration and only after you have established rapport with your patient. Most Americans often desire much personal space. The major challenge include the use of touch and protection of modesty. As a nurse, we are constantly touching our patients and putting our patients in different situations where modesty can be compromised. It is important for us to understand in certain communities, particularly affected are Muslims, Orthodox Jews, and Amish individuals. So if this concept goes back all the way from, I think, fundamentals, whenever you guys did the simulation on cultural awareness, you had a Muslim patient that was there, but also had a male relative that was present with the patient. You have to make sure that you always address those patients and explain what is actually happening. So I would direct all of my questions, all of my communication to the male counterpart, and then make sure that I ask permission to care for their female relative or vice versa. If that was the patient, I would make sure the patient was being directed all of the particular questions instead of the females in the room. But never assume anything. Always ask the patients about their preferences, because just in this particular situation, because what might be the norm, it might be altered in this particular healthcare environment, because the patient might be feeling scared or may have their awareness compromised. So ask permission before we do anything when caring for our patients. Social organization is very important when considering families or basic social units. The definition of family and the criteria for inclusion varies among individuals and among cultures. Americans of Western European descent may have small nuclear families, whereas other cultures living in the United States may have large extended families. Delivery of nursing care can be enhanced by including family whenever appropriate. Nurses are in a keen position to advocate for inclusion of family in healthcare settings. It is important for us to make sure that we do not limit the number of family members when visiting their families in these different healthcare environments. However, this can be very conflicting with some nurses because it goes against hospital policies, or it may even go against the nurse's personal belief system. However, if you understand, in some cultures like in the Philippines, it is expected that family members will stay at the patient's bedside and participate in his or her care. So you can use this to your advantage by allowing the families to feel empowered when caring for their family members. If we're to use the concept of time, nurses and their patients have different perceptions of time. Time moves slowly for patients who is anxious or in pain, but moves quickly for nurses who has a demanding workload. The use of vague terms to denote the time may also cause a disparity between the nurses and the patient's perception of pain. Words like now, soon, or later may be vastly different nuances among individuals and groups. So it's important for us to make sure that our own perception does not interfere with that of the patient. Some cultures primarily present oriented. You should make sure that you are present with the patient and make sure that you understand what their perception is and it doesn't collide with that of your own. When considering environmental control, a major aspect of culture is desire to control nature to facilitate the needs of human beings. The concepts of nature may include other worldly forces or beings such as deities and spirits. For some individuals, this may compromise whatever they might be thinking individually and conflict with how they're going to deliver care. As nurses, we are supposed to be extremely objective and provide the safest environment for our patients to heal in. We may not always agree with certain practices, but it is our responsibility to make sure we respect every suggestion by a family to help with increasing healing. Traditional healers are something that is very common, especially in Louisiana. I can remember my son had asthma and suffered from it, and I remember my grandma brought us to this place where they were this tree to. They took a piece of his hair, put it inside of the tree, and it was supposedly as he grew up, he would never have another asthma attack. Of course, that's not something that took place because he did have another asthma attack, but it is the tradition that they were going to try and make sure that they all prayed for this child to heal from this horrible sickness that he had. Spiritual advisors are something that we have to make sure that we always include whenever we're going to be caring for our patients, because what if they're asking for the last sacraments? For some people, or even people at CBU, they might not even know what 7 sacraments are, the last sacraments are, or a patient might even refer to it as the last rites. A couple of students thought the last rites were the right patient, the right dose, the right medication. Obviously, that's not what they're talking about. When a dying patient is present, especially in Catholic faith, they allow them to get the last sacraments. But it's important for you to make sure that you're being respectful and honoring what the patient is requesting. If we're to consider biological variations, we must consider pharmacogenetics. Pharmacogenetics refers to the general study of all the different genes that determine drug behavior. If we're thinking of the Genographic Project, it has performed DNA testing on populations all over the world, and the findings reveal that human beings are 99.9% genetically identical. This implies that there are not multiple races, but multiple genotypes. So this is a totally different concept from what we know is, because everyone is separated according to race. But according to this project, everyone is separated according to their DNA. When considering the nursing process or applying the nursing process to the transcultural consideration, we would continue everything that we've done before. ADPI would definitely be a part of the considerations, but what would be the highlighted piece is the patient teaching. We're responsible to educate and teach our patients even when there might be some cultural barrier that might be present. To look at the process a little further, when we're considering assessment, it is always important for us to assess the patient's cultural and racial background. We have to make sure we understand what the patient's ability is to communicate using standard English, and if they cannot, then we must obtain a translator for the patients. We have to determine if the patient participates in traditional health practices or has a complementary or alternative medical practices. We also have to list the patient's use of pharmacotherapeutic agents, including prescription medications, over-the-counter drugs, any types of herbs, any types of teas, and if they actually have or include a traditional healer who helps facilitate compliance with these prescriptive therapies. We must inquire about the patient's preference regarding touch, modesty, and personal space, and you have to gauge what the patient's perception is. If you're thinking of properly diagnosing this patient, anxiety, impaired communication, ineffective coping, and ineffective self-help should all be a part of the patient's nursing diagnosis. If we're considering planning for our patients, we have to collaborate with the patient to reduce high-risk health behaviors. It's important for us to make sure that the patient's health needs will be met with a culturally competent framework. patients will be more effective if we manage the patient's health care. In regards to nursing interventions, we have to incorporate non-harmful traditional practices with the use of biomedical prescriptions. So it has to be appropriate, and a translator must be present in order for that information to be relayed to the patient so they understand the risk factors that might be present. We have to anticipate whatever the therapeutic communication with the patient might be, and whatever the significant others who use that standard may reveal as well. Provide space for our patient, right? So that they could have, they won't feel stressed, and configurations for individuals, patients, and members of their social groups when delivering nursing care. So if we can, try to include the family as often as possible. Allow the patient adequate time with significant others, and make sure that we recognize the need for the patients to exercise control in their environment. We can't take away all of the patient's power, so it is ideal for us to make sure that we understand that empowering our patients will help in their healing process. We have to consult with other people who are knowledgeable about the patient's culture and who are aware of what is in the mainstream process. Facilitate as much of the mainstream prescriptions, but we have to make sure that we are being honoring to whatever is a part of their traditional practices as well. When teaching our patients, we must include the family in the teaching about what is a part of the prescriptive therapy. Again, family is a part of the social group and can assist with the patient's process of healing. If possible, use illustrations to explain what the prescriptive therapies are. And finally, in our evaluation process, monitor the patient's adherence to the prescriptive therapy. The patient correctly demonstrates understanding of the therapy and of the treatments. We cannot assume that the patient understands if they just nod their head or if the patient is just being polite. So evaluate physical, social, and psychological outcomes of the prescriptive therapy in order for you to understand if your goals have been met.